So if you wouldn't mind, do yourself a favor, grab a pen, grab a piece of paper so that you can keep notes during this case presentation. Go ahead and pause, take a moment to grab a pen and a pencil. Okay, now we are going to jump right in. So here we go. We have Bob Spartan. He's a 53-year-old roofer. He just fell 25 feet from the building under construction. He initially struck the ground with his feet and fell onto his left side. He had paramedics arrive to the scene, and he's complaining of severe back and lower leg pain. His vital signs are as follows. Blood pressure is 140 over 88, heart rate is 112, respiration rate is 28, and pulse oximetry is 96% room air with a temperature of 98 degrees Fahrenheit. His Glasgow Coma Scale is 15. His odds of survival are pretty good at this point because you know that any trauma patient that has vital signs that are intact, they have 95% chance of survival. So paramedics on scene, they administer oxygen at a flow rate of 15 liters per minute via non-rebreather mask, and they've applied a cervical collar and a backboard. To immobilize his neck and spine, of course, they also placed a 16-gauge intravenous catheter in his left forearm and began an infusion of 0.9 sodium chloride solution. So, question for you at this point. If this gentleman were on his way to your hospital emergency department for treatment, would you be prepared to provide immediate, appropriate nursing care? So, go ahead, get your pen out, get your piece of paper. This is going to be the first question I want you to answer for this week's discussion post. So your first question is, how will you get ready for this patient? Please pause the video now and take a few moments to jot down your initial ideas. So emergency department nurses must be prepared to deal with any type of injury, and learning details about the mechanism of injury can help them predict the types and combinations of injuries that this patient may have sustained. So the mechanism of injury basically describes the circumstances and energy, the forces that produce the trauma, and these can either be blunt or penetrating in most circumstances. So when you're thinking about this patient that you have limited information on so far, and thinking of the mechanism of injury, what types of injuries do you suspect in this patient? So your second question that you'll be answering for this week's discussion post is as follows. What types of injury are you suspecting in this patient? Go ahead and pause the video, take a moment to write down your initial thoughts. So trauma care always begins with the primary survey, and for those of you who aren't familiar with the primary survey, it's an assessment of the patient's ABCs, right? With the addition of D, which stands for disability, and the letter E, which stands for exposure. The primary survey focuses on what can kill the patient right now. And it's been followed by the secondary survey, which essentially is a complete head-to-toe assessment to identify other serious injuries that could kill or disable the patient later. Your next question for this discussion post of this week is as follows. What type of resuscitation do you suspect this patient will need? What interventions will be needed for your patient? Go ahead and take a moment to jot down your answers to this question. Now let's dive a little bit further into the primary survey. So the primary survey, of course, stands for airway, breathing, circulation. And the first part of the primary survey is always assessing the airway. So after assessing the airway, you realize that the patient has mid-face trauma. How is this going to change your care? You're noticing trauma to the face. So your next question for this case scenario is as follows. How will you pass a gastric tube if the patient has evidence of face trauma? It's okay if this is a one-word response. The next component of the primary survey is breathing. So this is essentially where you're assessing your patient's breathing. You're going to want to know the respiratory rate and depth. You're going to want to know chest expansion, any accessory muscle usage, and of course, auscultate the breath sounds bilaterally. Also palpate for crepitus or subcutaneous air in the neck and chest, which could potentially indicate a pneumothorax or other type of airway injury. Find out if your patient has pain on breathing or palpation. Supplemental oxygen is always indicated at this stage in the game. For a spontaneously breathing patient like yours, it would be helpful to give the patient a non-rebreather mask with the flow rates starting anywhere from 12 to 15 liters per minute. And if at this point you realize that your patient isn't breathing well enough to sustain optimal oxygenation, how will you intervene? The next component of the survey is circulation. And once you've assessed and supported your patient's breathing, you're going to want to, of course, attend to his circulatory status. Assess for the presence and quality of peripheral pulses to quickly estimate the blood pressure. And this can be done as follows. So if you have a radial pulse, it's safe to say that the systolic blood pressure is at least 80. But if your patient has lost his radial pulses but still has a femoral pulse, it's safe to say the systolic blood pressure is at least 70. But if all you can find is a carotid pulse on the patient, then you know the systolic blood pressure is at least 60. So your next question for this case scenario is as follows. How often will you collect your patient's vital signs? Also, please ask yourself if the mechanism of injury makes any internal hemorrhage a likely event, because this is probably going to have an impact on your interventions and your priorities going forward when managing this patient. So during the primary assessment, you realize that your patient's vital signs change significantly from those obtained by the paramedics. You're noticing the blood pressure has dropped from 96 over 58. The pulse ox is now down to 95%. Heart rate is up to 120. Respiratory rate is remaining at 28. And the temperature is now 97.4 degrees Fahrenheit. He has no external hemorrhage, so the nurse practitioner who is examining the patient is suspecting a spleen injury. And let me tell you why. So he knows that the patient kind of fell onto his left chest and abdomen and has some pain to his left lower rib cage on palpation. So, of course, you hang a liter of 0.9 sodium chloride using the high volume fluid / warmer and begin the infusion with a second peripheral IV line. And of course, you are very skilled and you are able to obtain a 14 gauge IV. So now that we've kind of gone through the ABCs, we're going to jump into D, which stands for disability. And of course, after D, we have E, which stands for exposure. So during the secondary survey, you will be trying to uncover any other serious threats on the patient. So things that you look for under a secondary survey, you're going to move in a systematic manner, of course, as always, moving from the head to the toes, and you're going to be looking out for any types of abrasions, any type of contusions, lacerations, any deformities, any skin discoloration anywhere, any edema, any foreign bodies, or any other abnormalities. And one acronym that you guys will find helpful when gathering this history, whether it's from the patient or a family member who has now arisen, is the acronym AMPLE. Okay, so AMPLE stands for allergies, medications, past medical history, last meal, and events or environment related to the injury. Okay, So you find that the patient's secondary survey, it's remarkable for pain on palpation in his lumbar spine, tenderness and abrasions over the left lower rib cage anteriorly, and heel pain and swelling in both feet. So at this point, you insert a urinary catheter and perform a dipstick urine test, and it's positive for a small amount of blood. Next step in the game is we're going to be keeping an eye out for diagnostics. So probably going to anticipate a handful of x-rays and CAT scans as well. You notice that the patient has a bedside ultrasound, and this is focused mostly on the abdomen using what we call the FAST technique. And this is used to rapidly examine all 4 abdominal quadrants in addition to the pericardium to identify any types of free fluid. Most commonly we find is blood. So after our diagnostic workup is performed, so this was including a FAST exam, this was including chest, pelvis, and lower extremity x-rays, a few series of spinal x-rays and CAT scans of the head, the cervical spine, chest, abdomen, and lumbar spine. These tests reveal injuries at the 9th and 10th ribs on the left and an L3 compression fracture. Unfortunately, this patient also has bilateral calf calcaneus fractures, renal contusion, and a grade 3 spleen injury. So in terms of providing definitive care for this patient, what are you anticipating? Take a moment and jot down your answer to that question. Where will this patient be going? Are they staying in your hospital? Do they have to go to an ICU? What kind of things are you thinking about here? And you might also be wondering, how do you know at this point if your patient has received adequate resuscitation? And I'm going to give you guys a few points that you can think about in terms of this question. So if we have normal hemodynamic and renal parameters, these are good signs, right? If the core body temperature is normal, again, good sign that the patient has received adequate resuscitation. If the serum lactate is less than 2, if you notice that there's no base deficit, the arterial pH is normal, meaning between 7.35 and 7.45. If the hemoglobin is greater than 9, if our ionized calcium is within normal limits, if our serum potassium is within normal limits, like between 3.5 and 5.3. What else? Pain is under control. These are things that point towards adequate resuscitation has been achieved. So an organized team approach is in the first hour after any traumatic injury, provides fast and efficient care and can help save lives. Because you and the other team members have prioritized your assessments, your interventions for this patient according to the recognized standards of trauma care, you've given him the best chance for survival and a full recovery. I hope that you've enjoyed this week's case scenario. Please respond to the questions throughout the case scenario, and I will also provide them in Canvas. Have a great week.